Hello, this is your dietitian, Panda Mission of Health and Wellness. I've been getting a lot of questions from my clients and about what is B12, where do you get B12 from, and how does it work in the body. So I put a little presentation so that I can answer several people at one time. Okay, B12 helps to build your DNA, your red blood cells, and particular during times of rapid growth, and it maintain and protect the shield that's around the nerve fibers. B12 also protect the lining of your arteries. Like if you look at this, the B12 actually protects the lining of your arteries. Okay, the arteries wall, and this actually, if this process is not being done, or if you're low in B12, it can actually create and trigger certain heart disease. A deficiency of B12 can have mild or severe consequence, such as gastric problems, gastrointestinal problems, severe nerve damage like numbness, tingling in the hands and in the feet. You can actually even have memory difficulties and some form of anemia like megaloblastic anemia. If you have certain symptoms, sometimes like fatigue, weakness, change in mood, shortness of breath, palpitation, or have reasons to suspect that you have a B12 deficiency, please consult your healthcare provider, and they can also arrange some lab tests for you to take. Now let's look at B12. Lot of times people ask me, where do you get B12 from? And they're thinking that they're getting it from the meat that they're eating. But let me tell you how B12 are made. B12 does not occur naturally in food. It's made from the bacteria from the ground. So the animal eats the grass, they get the B12 from that. If you pluck out a vegetable or a fruit from the ground, you usually get B12. But because we're a society that washes everything, especially with the coronavirus, we wash every ounce of B12 that is on our fruits and veggies. So we and you know, a lot of the animals now are not really grazing. They are getting food bought into them, so they're not going like in the dirt and the earth and eating that grass. So you can see why they're even recommending that everybody, whether they don't eat meat or not, they really should take some form of B12. So remember, B12 is a water-soluble vitamin, which means that you do not store the excess. So you'll just pee it out, or just in the urine, you'll just get out the excess. And again, I just really want to be clarified that animals do not make B12. B12 is made from bacteria. Now, sometimes when you're on long-term metformin or anti-acid blocking medication, this will also decrease and the absorption of how well your body absorbs B12. So really and truly, I always recommend to my patient, if you're on metformin for over a length of time, you really need to speak to your healthcare provider about possible getting your B12 checked and possible going to maintenance of B12. And the reason why, if you're on anti-acid medication, is that you need the acid into your stomach to absorb the B12. So you really want to make sure that if you're on anti-acid medication, that you really get your B12 level checked. Now, the recommendation for B12 out there is that the recommendation intake for adults is usually about 2.4 mcg. And you usually spread that over the day. However, many experts suggest maybe 4 to 8 mcg. It will take a single dose of supplements. So it is suggested by many experts that you take 25 to 100 mcg per day, or 1,000 mcg twice a week. For optimal absorption, it's best to chew it instead of swallowing it. Now, some studies have shown that babies that are breastfed, and if their mom are taking enough vitamin B12, the baby is okay. But as soon as that baby is weaned from both either breast milk or formula, you should speak to the pediatrician about possible recommending some kind of B12 drops. So I cannot stress this enough. Always speak to your healthcare provider. Work with your healthcare provider. Okay. You can also get B12 from fortified food, but because it varies and it's not as reliable as we might think, you might consider still doing some kind of supplemental for B12. You might have heard of nutritional yeast. Nutritional yeasts are grown on B12 enriched medium, and about 2 tablespoons will provide you about the 2.4 mcg that I was telling you about, which is a daily recommendation. Again, because nutritional yeast might vary in how they're growing, where they're growing, it might not be exact. So again, I do recommend that you speak to your healthcare provider about possible supplementing, no matter where you're getting it from. It is very, very important, especially for your nerves. Very, very important. So again, this is Paula Allison, your dietitian, Panda Mission of Health and Wellness. God bless you.